Hi there. I'm Tara Drake, and I just caught up with Congressman Barton. Hi, Congressman Barton. Nice to meet you. I'm Tara Drake, and I'm a nursing student at University of Texas at Arlington. I'm getting my master's degree. I'm currently in nursing class 5382, Nursing and Healthcare Policy, and we're studying obviously healthcare policy. And I've chosen Bill HR 1231, Race for Children's Act, and I understand that that's a policy that you support currently.
Yes, ma'am.
Yes, okay. So I just wanted to talk to you a little bit about that policy and make sure that we continue to have your support here at the Association of Pediatric Hematology Oncology Nurses. So one reason that this policy piqued my interest is because I'm a pediatric nurse and because my specialty is oncology. So something that I found very interesting was that currently there's a lot of drugs that we use to treat oncology patients, but there's not a lot of targeted drugs that we use. So adults get all these targeted drugs, but they never are used on cancer patients in the pediatric world. So what this bill is doing, in my understanding, is going to help these kids get the drugs that they need, essentially. Is that true?
Yes.
Okay. So as a sponsor of this bill, you're going to take this up through the subcommittee of health and get it carried through to get passed. I'm hoping you'll continue to support this bill. So one of the things that I found was that the Center for Disease Control and Prevention reported that childhood cancer is the #1 killer of children. And according to the National Institute of Health, nearly 2,000 American children and adolescents die of cancer each year. So if we targeted cancer cell in these kids, it would really increase the survival rate for children. So a perfect example of that would be Philadelphia positive ALL. So used to, these kids would have a very poor prognosis, right? Like that was a death sentence for them. But with the finding of tyrosine kinase inhibitors, or TKIs, we know that this significantly increased their survival rates, right? So Philadelphia positive ALL is not a death sentence for kids anymore. Like, it still has a poor prognosis, but we know that the survival rates have significantly increased with just this one targeted therapy drug. So if we did that for the rest of cancer patients, imagine the survival rates and how much they would go up. We're at 80% survival rate for leukemia at this point, but if we targeted each one of these genetic chromosomes on cancer cells, we could really increase the survival rates. But at this point, it's all adult research and no pediatric research. So HR 1231 would really help us with this. So what I'm asking from you is your continued support as this bill goes through the House and Senate, and that you'll continue to support it and help us with that.
Yes, ma'am.
Great. Thank you so much. It was nice meeting you.
It was nice meeting you.